Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
In the domain of childhood habits, one phenomenon that often captures the attention of parents and carers is the practice of thumb sucking. Seemingly innocent practice, yet one laden with implications. Thumb sucking is a natural instinct that can persist through various developmental stages. As we initiate this discussion, we'll unravel the layers surrounding this behavior, delving into its potential impacts on oral health and the strategies employed by parents and carers to guide children through this phase. Welcome, everyone. I'm Dr. Soumya Saluja from SIP Media, and in this session, Dr. Gauri Kalra will share valuable insights on the impact of thumb sucking on children's oral health. Dr. Gauri Kalra is a distinguished professional in pediatric dentistry with over 10 years of experience and currently holds the position of professor at Manav Rachna Dental College in Faridabad. Previously, she held the role of senior resident at the esteemed All India Institute of Medical Sciences. Concurrently, ma'am also works as the associate editor at the Journal of South Asian Association of Pediatric Dentistry. Beyond her academic engagements, Dr. Kalra brings a wealth of experience to her role as clinic head, overseeing clinical operations and upholding stringent standards of patient care for 12 years. Her diverse experiences underscore not only her dedication to the dental profession, but also her commitment to shaping the future of pediatric dentistry. So, Dr. Gauri, Vip Media welcomes you, ma'am.
Thank you so much, Dr. Soumya, for this wonderful opportunity. How can I help you today? Yes, tell me.
Thank you so much for joining us, ma'am. And today, I wanted to discuss something very important, yet a very neglected issue in kids. We call it the habit of thumb sucking, right? इसको हम जनरली मानते हैं कि एक बहुत कॉमन बिहेवियर पेरेंट्स नोट करते हैं अपने छोटे बच्चों में, स्पेशली टॉडलर्स में, एंड दे बिलीव कि इट विल जस्ट डिमिनिश जैसे बच्चा बड़ा हो जाएगा. सो एक पॉइंट आएगा जहां पर पेरेंट्स के लिए ये बड़ा नेचुरल हो जाएगा कि ये प्रॉब्लम क्या नेचुरली सीज हो सकती है, या अब ये एक उनके लिए एक मैटर ऑफ कंसर्न की तरह से appear na kar jaye. So I'm going to begin this discussion by asking that, what age, should parents be concerned about this habit of thumb sucking? In other words, I mean, are there any age specific or age related factors associated with this habit?
See, actually, do you know the fact that when does the habit of thumb sucking actually starts? It starts in utero, when the baby is inside the mother's womb. So if we see a 7th month ultrasound scan of a baby who's unborn, you might, experience a child sucking his finger or a thumb. So it's a very natural and physiologic behavior in young children, that is infants. So I would say it is very much normal till the age of 2 to 3 years of age, because when the child is having milk, primarily either through a bottle or by his mother or her mother, okay? So that suckling reflex, is very dominant in very small children. So if you see that till the age of 3 years, it's very normal to see a baby who's thumb sucking or finger sucking. And till that age, I would say that basically there is no harm that that habit is causing to the oral cavity, the mouth of the child, which has the teeth and the jaw bones, okay? But when you ask that age related, so there is no age related, thing related to that. So it is basically related to the maturity level of the child. Okay. If there is a younger child who's anxious or who's hungry, then he will definitely look for food, or if it's not available or her mother is away, then he would just try to suck and comfort himself or herself. Yes.
Okay. And I mean, are there any common factors that, other than just age or let's say maturity, that
Hmm.
could, lead to this problem of thumb sucking in children, other than age-related factors or maturity?
See, gender-wise, if you see, there are a lot of
Mhm.
researches which has happened. Okay, so
Okay.
some studies have shown that girls are, more emotionally. You can say they are more emotional than boys, so they are more into this habit of thumb sucking. What the studies have proved, I don't
Yes.
think so. Otherwise, yes, the knowledge of parents, the socioeconomic status of parents also matters a lot.
Okay.
Like, if the parent is aware that till how long the child should suck, or
Mm-hmm.
if the parent is educated, then I think the people who are
Mm.
more educated will have lesser habit,
Okay.
right?
Right. So,
And the number of children, if suppose the mother is working or the father is working, and then there are the lot of siblings in there, so the little more, the youngest child might have thumb sucking habit because he might get ignored, or the elder one because the parents are busy in two three children. So all these factors, other than age related, can cause the habit of thumb sucking.
okay. And I mean, are there any common dental problems associated with this prolonged habit of hump sucking? And
Yes.
I mean, so I mean, are there any specific signs or milestones that, that could indicate to a parent that, it's the right time for, dental intervention or dental evaluation?
See, there are a lot of problems which occur because of
Yes.
thumb sucking. Till the age of 2 to 3 years, I told you that it's quite normal and it doesn't cause any major changes in the body.
Right.
So, but when the time comes, when the permanent, okay, not the
Mm.
milk teeth, the permanent teeth start coming in the oral cavity in our mouth, then
Right.
it starts creating some changes, okay? Because
Okay.
as we know, the children are young, so the bones are very flexible.
Right.
So if a child is continuously sucking the thumb or
Right.
the finger, then
Right.
it creates an abnormal pressure on
Okay.
the mouth. Okay, it creates abnormal pressure on tongue, teeth, the jaw bones, everything gets imbalanced. So then you might have forwardly placed teeth in the front region, or they're out, the teeth do not match in the front region, so it kind of gets, you create an open bite. The child is not able to close the mouth properly, the teeth
Mm.
are open. Okay, so this
Mm-hmm.
affects the speech also of the child, because
Right.
for certain words or letters, we need to close our teeth. Like when we say s or c, then we need to close our or clench our teeth. So that means that time the child is not able to do.
Okay.
Also, the upper jaw, which is very porous, as we all know. So
Mm-hmm.
that also, changes the shape. It becomes constricted, it becomes narrow, it doesn't develop properly. The tongue also gets affected. So there are many things that happens when the child is sucking after the age of 3 to 4 years.
Okay.
Yes.
Okay. And if a parent, comes to a pediatric dentist, or let's say a dentist, so
Yes.
how does a specialist or a dentist, handle the oral impact of thumb sucking in a child?
Ideally, we should see dentist by our first birthday. Okay, whenever
Right.
the first tooth erupts in the oral cavity of the infant, then he's
Right.
no more an infant, I believe. He becomes a younger child. So one should visit that. If not possible, a pediatric dentist, because many of us are not aware of that there exists a subspecialty in dentistry. So
Correct.
ideally, what I believe that the knowledge and awareness of a pediatrician is also very important in this. They should be able to diagnose this thing that yes, the child is having the habit of thumb sucking and it
Right.
has started creating changes in his mouth, on his teeth, bones, the jaw bones basically. So he should be able to refer the parent, the child to the pediatric dentist. So
Okay.
ideally, every 6 months after 1 year, you should have a regular dental checkup, either by a dentist or a pediatric dentist.
Okay. And one important factor that you just mentioned about the girl child and the anxiety level, the
Yes.
kids could be anxious. So how can parents and carers, that differentiate this physiological or let's say normal thumb sucking behavior in young children from
Hmm.
more concerning habits that could require, professional intervention? I mean, can a dentist help here?
Yes, of course. See, you have to identify the root cause, that why the child and when the child is, sucking either his fingers or thumb. So if a child is alone, if the child is scared, that child might not be hungry always, right?
Right.
So basically, the parents need to get associated with the child at that level, mentally and emotionally, to understand that whether the child is doing it consciously or subconsciously. So if the
Right.
child is doing consciously, then we need to eradicate, we need to counsel that child, that we need to basically understand the child's psychology and motivate the child that this is not the right thing, what is to be done.
Okay.
And you can have sessions, pediatric dentists, we can hold, as pediatric dentists, we can hold sessions with parents to make them understand and how we need to counsel the child. Okay, we can introduce either child counseling sessions personally with the pediatric dentist in front of the parents. We can counsel the parents also, and the parents can reward the child, not shame the child that what are you doing, okay, not in front of the society or other people, that is not a good thing, you're a bad boy or a girl, whatever it is. So they have to take care of this thing very positively and very calmly and patiently.
I think that was very insightful, Dr. Gauri. And I really appreciate your presence today for this wonderful discussion. So
Yes.
thank you so much for joining us today.
I would also like to thank you once again for this opportunity. And last but not the least, I would say that if the parent notices the changes in the jaws and the teeth in the oral cavity of the child after the age of 4 to 5 years, then they should contact the pediatric dentist. And we would try to counsel the child first. But if the habit has really become stubborn or he's doing the habit subconsciously, then we have a lot of orthodontic wire components. We have, in simple terms, I would say special braces to break this
Okay.
habit. Yes.
Okay. And I'm hoping that this conversation will be beneficial for many families, right?
Yes, of course.
Yes. And for all the parents tuning in, it's important to understand that, these seemingly harmless habits can actually become addictive, negatively impacting your oral health, your child's oral health, and potentially indicating some underlying psychological issue. So we encourage you to be vigilant and consider the valuable advice by Dr. Gauri. Thank you so much, ma'am. And for more such informative videos, please subscribe to our channel and press the bell icon for regular updates. Thank you once again.
Thank you.